Hi, my name is Haley Jaggers, and this is my final project presentation on diversity and conflict management training at St. Joseph Regional Medical Center. Diversity training and conflict management programs are implemented in all different types of businesses and corporations, from small to worldwide. The reason these programs are put into place is so that their employees can communicate effectively with each other as well as with their customers. The need for these types of programs in medical facilities is great, due to the many different types of people that work at and/or use the services of hospitals, doctors' offices, ambulances, etc. The following statistics regarding healthcare employment in the U.S. are based on occupational classifications established by the U.S. Bureau of Labor Statistics and include medical and health services managers, healthcare practitioners, and technical occupations, as well as healthcare support occupations. As of 2009, there were 11,414,440 people in the United States employed in healthcare. When I began the foundation of this project, I asked myself a research question. What diversity training is available for medical professionals in the workplace, and how beneficial is it in the medical facility between employees and with patients? If necessary, how can these services be improved or geared more towards our community? I will now go on to present my thesis and argue why the St. Joseph Regional Medical Center needs to make a drastic change soon. St. Joseph Regional Medical Center's diversity training and conflict management program is not a beneficial training tool for its employees, patients, and community. I believe this cultural space would benefit from a greater commitment to a new and much improved diversity training and conflict management program to better practice effective communication within our community's myriad of different cultures. St. Joseph Regional Medical Center says that they are doing one thing for their programs, but they are doing something completely different than what they are saying they practice. When comparing St. Joseph Regional Medical Center's program training material to another's, I found that they were extremely lacking in pretty much all areas. I have seen firsthand how St. Joseph Regional Medical Center's program is not working effectively and needs improvements. St. Joseph Regional Medical Center says that they are doing one thing for their program, but they are doing something completely different than what they are saying they practice. We see this currently because there is no administrator in position for diversity and conflict management at St. Joe Regional Medical Center. While I was asking around St. Joe as to who I would speak with about diversity training and conflict management programs, I was transferred at least 3 times before someone told me that there was no one currently in charge for this after the last administrator recently left that position. During my interview with Dave Goldman, instructor recruiter for St. Joe, he stated that currently we have all St. Joe Med employees go through a new employee orientation class that includes a PowerPoint on diversity training and conflict management. There is also a course on HealthStream for employees to take through their iLearn accounts for further diversity education, but similar information. Following our phone interview, Dave informed me by email that the PowerPoint presentation he used to use for their training program is no longer used, and that the only thing available is the iLearn module on HealthStream. There is no plan, system, or survey used currently to see if the minimal training provided is beneficial or not. Dave also stated during the phone interview, "I'm not sure that we go that deep into diversity training, other than how to get along with people of different races. But I would be happy to email you the PowerPoint presentation that I use, as well as looking into getting you access to the iLearn course." Again, this illustrates how they make several claims of the 2 parts of their very insignificant program. But quickly you can see that with further research and inquiries that they are practicing differently. Martin and Nakamaya define in our text diversity training as the training meant to facilitate intercultural communication among various gender, ethnic, and racial groups in the United States. The diversity training and conflict management programs at St. Joe Regional Medical Center is basically becoming non-existent. Therefore, creating a cultural space with a poor communication foundation and guidelines, they need to use programs that are already currently in place and are successful to model a new program. When comparing St. Joseph Regional Medical Center's program training material to another's, I found that they were extremely lacking in pretty much all areas. The PowerPoint presentation that was used for the new employee orientation is no longer being used at all. Although Dave, from my previous interview, was kind enough to allow me to examine the PowerPoint presentation on diversity training in the workplace, it is no longer in use and is only important for the use of analysis of the previous methods and to compare it to other methods being used by other organizations. When starting to analyze this PowerPoint and the information included, I chose to compare it to a PowerPoint on diversity and inclusion from the U.S. Department of Veterans Affairs. I chose this organization because finding information for other hospitals' programs was a little bit more difficult, and this program was easily found and very applicable. In comparison to the U.S. Department of Veterans Affairs, the PowerPoint on diversity and conflict management, St. Joseph Regional Medical Center's program is extremely lacking and unprofessional. It lacks detail, resources, and supporting information to guide employees. As we can see, other organizations, such as the U.S. Department of Veterans Affairs, take programs for diversity training and conflict management much more seriously than St. Joseph Regional Medical Center, and the evidence is in the textual analysis comparison. I've seen how the lack of information and proper training has affected St. Joseph Regional Medical Center and its employee communication. I have seen firsthand how the St. Joseph Regional Medical Center's program is not working effectively and needs improvements. After going to the new employee orientation at St. Joe, I did not find any information provided beneficial for diversity training or conflict management. I work with and am responsible for the care of individuals from all different cultural backgrounds. I do not feel like I received cross-cultural training as it is defined by Martin and Nakamaya in our text. Cross-cultural training is defined as training people to become familiar with other cultural norms and to improve their interactions with people of different domestic and international cultures. After working with others in my facility, I have found that several others, people in power in particular, make very little to no attempt to respect other diversities different from their own. This included contact with fellow employees and patients as well. St. Joe needs better leadership management personnel who will make these changes happen, not just in writing, but actually put to use in our facilities. A better diversity training program would not only benefit the employees and their relations, but also St. Joseph Regional Medical Center as a business and an aid to the community as a whole. Our text emphasizes power in intercultural interactions on page 139. It points out that, regardless of whether we choose to recognize the foundations for many of our differences, these inequalities influence how we think about others and how we interact with them. It continues to say, the more you know, the better you will be positioned to engage in successful intercultural interactions. I had a very difficult time finding information for diversity training and conflict management resources other than through the hospital translator. Francesca, the head of the interpretation department at St. Joe Regional Medical Center, stated during a phone interview that, I don't know of any diversity training or conflict management skills that have been implemented since I've been here. It should be noted that she's been at St. Joe Regional Medical Center for 10 years, and the only thing she could remember St. Joe doing for other cultures was putting up signs limiting where males could go and not go in different languages in the hospital. This applies to different religions. With cultures and people constantly coming in contact in these kinds of environments, it is important now, more than ever, that we, the employees of St. Joe Regional Medical Center, are well equipped with the resources, knowledge, and skills to handle diversity and conflict management with effective communication to avoid future issues. My final thoughts on this project are the resources that were available for diversity training and conflict management are not beneficial. St. Joseph Regional Medical Center says that they are doing one thing for their program, but they are doing something completely different than what they are saying they practice. We see this through the interviews with Dave and Francesca and how they are stating what they have done in the past and examine what they are really doing now in the present and how this does not satisfy the specifications by our text. When comparing St. Joe's program training material to another's, I found that they were extremely lacking in pretty much all areas. This is obvious after viewing the U.S. Department of Veteran Affairs PowerPoint presentation versus the St. Joe Regional Medical Center PowerPoint presentation. They are not using anymore. I have seen firsthand how St. Joseph Regional Medical Center's program is not working effectively and needs immediate improvements. The amount of negligence and lack of implementation of the current program and poor program that St. Joseph Regional Medical Center has in place is discouraging for me as an employee, and yes, sometimes as a patient. I feel as if I have nowhere to look for guidance, resources, or support on how to better prepare myself for possible cultural differences and intercultural conflict. St. Joseph Regional Medical Center should hire someone to put into position of power with previous work experience and a successful diversity and conflict management training program. They need to reevaluate their current training methods and implement these new methods immediately. They need to use programs that are already currently in place and are being successfully used to model a new program. One example of things that could be implemented into the new program is from our text on page 455 through 456. It states, "There are no easy answers in dealing with intercultural conflict. Sometimes we can apply the principles of dialects. Other times we may need to step back and show self-restraint. Occasionally, though, it may be more appropriate to assert ourselves and not be afraid of strong emotion." We can also see this in the 7 suggestions for dealing with conflict. The 7 suggestions for dealing with conflict include: stay centered and do not polarize. Maintain contact. Recognize the existence of different styles. Identify your preferred style. Be creative and expand your style repertoire. Recognize the importance of conflict context. And last, be willing to forgive. Guidelines like these will help St. Joseph Regional Medical Center better prepare their employees for possible everyday conflict in any situation. Why is this project important? It's important mainly for patient satisfaction. If our patients are unsatisfied, they're likely to go to another hospital, or they're likely to give us a really poor review on our patient surveys. It's also important for employee satisfaction. The happier your employees are at the place of their work, place of employment, the more likely they are to stay employed there and not look for a different job somewhere else. Employee satisfaction is also important because if employees are more satisfied with where they work and how they interact with other employees, conflict is less likely to arise between employee-employee communication. Hospital credibility is extremely important. If St. Joseph Regional Medical Center as a business is not credible, then this lowers the chance for patients to use the hospital again, as well as other people in the community to support the hospital. It's also important for future success. After reviewing the program, if changes are not made, future success for employee and patient communication will fail, and the likely for future success is not likely. So using these suggested actions, if St. Joseph Regional Medical Center were to see my presentation and possibly use that to take action, the likelihood for future success, I think, would be much greater than what it is now. This is the resource page for my presentation. These are the resources that I used for my outline and presentation as a whole. I hope that after you see this presentation, that you, as a intercultural communication student, further research maybe your own company's diversity training and conflict management programs, or other programs within your community, places that you trust to prepare their employees to communicate better with you. I think that these types of programs in all different kinds of businesses, not just a place of medical treatment, is important. Thank you.